Healthcare is very important. We all know that. We also know that if you don't have health insurance, that you have to pay out of pocket. How many times have you gone to the ER because you were not feeling well? How many times have you had to make a doctor's appointment because of an illness that you have? How many times have you had to go back for a follow-up appointment because of this particular illness? How many times have you called and made a doctor's appointment and the first thing that the rep say on the line is, do you have insurance? How many can say that their answer is no? I can. Yes, there is Obamacare that is out there. But however, there is also a downside about not getting it. Healthcare should be free for those who cannot afford to pay out of pocket. I am a single mother with 2 kids. I work a part-time job. Sometimes I have more bills than I have money. And sometimes the cost of health insurance can be extremely high. Yes, my kids are covered, but I'm not. I was once on TennCare, but because I had gotten of age, they took me off. My kids were still covered somehow. And honestly, the only way to get back on TennCare is you have to be with child, or you actually have to have a chronic disease such as cancer. Why is that? Why can't those who cannot afford to pay out of pocket, or who cannot buy into insurance or get coverage on their job, receive free health care? Free health care is very important, we all know. But if you can't pay for it, then sometimes you just have to go without. It is sad to believe that a lot of people find out that they have cancer very, very late, in the late stage of cancer, actually, simply because of the lack of screening. Doctor's visits can range very, very high. And in order to get the best service, it can be expensive. Healthcare insurance should be free for those who cannot afford to pay out of pocket. Some people are on fixed incomes, and some people just can't afford to pay that much for a doctor visit. I've been in the situation where I've been to the emergency room and was forced with a bill afterwards, simply because I did not have health insurance. This is something that should be changed. No one should be forced not to go to the doctor simply because they cannot afford the price or the cost of health care. This is something to think about. What if it was your mother or your father who could simply not pay for health coverage, and you simply did not have the funds to help them? Would you fight for free health care for those who cannot afford out-of-pocket pay?